Very good afternoon to all of you. Thanks for joining us here on Mirror Now. I am Afrida Rahman Ali. Let's begin with big breaking news coming in on the centre's new announcement on the vaccination drive. The Union Health Ministry today informed Lok Sabha that because of the evolving nature of the COVID-19 pandemic, no fixed timeline at present can be indicated for the completion of the vaccination drive. The centre expects beneficiaries above 18 years of age will be vaccinated by December 2021. Ayushman joining us with more input. So Ayushman, we believe responding to a question by Congress MP Rahul Gandhi and Mala Roy, Minister of State for Health Bharti Pawar has said that between August to December, a total of 135 crore doses are expected to be available. So clearly there are still certain doubts and apprehensions on the supply issue, because in terms of the states being prepared to vaccinate, things seem to be in order, but the supply constraints remain. Is that the reason why we see a shift in position now, where the government is talking about the evolving situation?
Well, the government is clearly saying that vaccinating above 18 population will be by December, but overall population, there is no fixed timeline because the children's vaccine is still under trial. So it will be important to see how the vaccines come, and then entire population, since it's a dynamic process, there can be no fixed timeline for that. But government has said that they are going to vaccinate above 18 population by December. Earlier, former Union Minister Prakash Javadekar had said that the government is aiming to vaccinate all in India by December this year.
Yes, but right now, of course, there's a rider to it where the government is now citing the issue of evolving situation, which means that Ayushman, one must be prepared to, to also accept that there can be a change in that timeline, but there's a huge risk involved in pushing that timeline further, isn't it? Because the country is, of course, right now the only tools and weapons available to us is vaccination, and with that getting delayed and with new variants in the offing, was anything mentioned about how that challenge can be overcome?
Well, the vaccination number, if you see the supply dose number in the month of July so far has been 6.3 crore perhaps, and if you see 6.3 crore is the exact amount till July 30th, till July 20th. So in coming 10 days, like a week is left, the government will have to supply around 4 crore doses to the states, which looks a rare possibility because the time frame is less. Because the government says that India has a vaccination capability of about 13.5 crore, out of which 25 crore will go to the private sector. So 10 crore is there for the states to procure. Now, when the states will get it from center, so how the center is going to give the 4 crore doses in next coming 8 or 10 days remains to be seen, Afrida.
Yes, okay, all right. There's some suggestions, of course, Ayushman, has already been made about how there can be a redistribution, a relook at the ratio of 75-25. Anything to that effect being considered or spoken about? Okay, I'm told Dr. Sunila Garg is with us now. Professor of Community Medicine in Maulana Azad Medical College in New Delhi, also member of the Lancet Commission COVID India Task Force. Good afternoon, Dr. Garg. In terms of the timeline, the centre is now shifting position a bit, saying that given the evolving situation of the pandemic, things may shift a bit in terms of the vaccination being completed by December 2021 may not be achieved. Now, is it really because of the evolving pandemic situation or because of the supply constraints? What do you see would be the fallout of this? If we push the timeline further, wouldn't that also pose greater risks for the country?
No, this question is a very valid question that you asked me. Two components. That one is the evolving nature of the pandemic, and then second is the shifting the timelines. That is there. One thing which we have to always remember is that we now have to relook at our distribution pattern also. We are giving 25%, from the part of center to the, private sector, which also I feel is not completely utilized. So we may have to think of this strategy as well, because you see what I found out, yesterday by, talking to different private sectors, that they are not able to utilize as people are not coming to private sector for paying the huge amount. Number two, because there is a big gap actually between the two doses, and then again the government sector is, providing the vaccination free of cost. Number one thing. Number two is that, as the vaccine pandemic is evolving, that is where we need to understand our vulnerable pockets. That means we will have to look at our rural areas, peri-urban areas, tribal areas, where, there is it's a challenge to vaccinate. We have to address vaccine hesitancy also. We have to look from the gender perspective also, that how we are going to go ahead with the immunization part and the number of vaccination points which will be set up over a period of time. So that is where, it's a bit of challenge to when we talk from this perspective. Urban perspective is little, well-defined now, but now as the cases are evolving from the rural part, the disease is now moving more towards those pockets which it had not affected first. So we have a large chunk of, population which has not been infected by the virus in the rural and difficult areas. So that is where, it may take some time, but by and large, we will be able to immunize majority of the individuals by the end of December 2021.
All right, but as part of the COVID task force, what is the ideal situation that we have to vaccinate as many people as quickly as possible? That was the primary issue. Is the country facing a setback in that because of constraints in supply?
See, number one thing is that we have to do our vaccination program very smartly, and number two, we have to do it very strategically. Smartly means now we have to look at those people who have already been infected right now, not to immunize them, and to go to those people who have not got the shots of the vaccination. Also, it will depend upon, the states which have got lesser vaccination, but, our seropositivity is quite very high. If I was to look at the state of, Rajasthan, where, the seropositivity is about, 18.2%. But, the vaccination coverage is, state of Rajasthan, if I was to look at where the seropositivity is about 0.1%, and then, the percentage of people who are immunized are 43.65%. So I will go there and immunize and give people the second dose as well. So that is important. But, as far as the other states are concerned, like Sikkim and all, though the seropositivity is about 18.2%, and we have vaccinated about, 101%. We say that. That is, it's about, our vaccination coverage is very good. So we can leave those people at that point of time, and then we can go to the vulnerable areas where the people have not been infected, neither they have received the vaccination. That should be our priority. Then only, we will call it as a smart vaccination strategy and a opportunistic vaccination strategy. And this takes involves a close look at looking at the complete picture as to how many people, in a particular state are immunized with one dose. So we have to give priority to the second dose. How much is the test positivity rate? Because still we have got states like Kerala where there is 11.3% positivity rate, or Manipur 16.7% positivity rate. So there we should have, though we have got 41% coverage, but then we need to look at how many people have got second dose and all that. That becomes critical at this juncture. Or Meghalaya 10.2% or Mizoram 12.2%. So it is very, very important to look at from these perspectives the total epidemiological data. Another, the challenge is now to reach to the pregnant and
that's a very important point. Yes.
Yeah, so that is where we need to identify them.
Yes, absolutely. And as per the ICMR Sero survey, ma'am, exactly in terms of what you said, that the new figures that the Sero survey has revealed indicate that 2/3 of the population are already showing the antibodies. 1/3 of the population, which suggests about 40 crore, are still vulnerable. So Dr. Garg suggesting identify the vulnerable first and get them vaccinated. That should be the focus. Thanks for joining us, Dr. Sunila Garg, for your inputs on the story.